If you live in Massachusetts and you've looked into Medicare supplement plans, you might realize that it's different than every other state in the country. The plans are different, the rules are different, and it's hard to figure out where they even begin. So today I'm going to go over Medicare supplement plans, specifically the Massachusetts, and this is really important information to know before you look into Medigap plans. So stay tuned. Hi, I'm Jamie Banner, and I'm the founder of Medicare by Jamie. I'm a licensed insurance agent that works specifically with people enrolling into Medicare, and today I'm going to talk to you about Medicare Supplement Plans, specifically the Massachusetts. Because like I said in the intro, if you've done any research into Medicare supplements in Massachusetts, there's not a lot of information out there. There's a lot of things that say if you live in Massachusetts, the rules are different, but then nothing elaborates on those rules. So today, I've put my Red Sox jersey on, and I'm going to talk to you all about what makes Massachusetts so different in terms of the plans and the rules that go along with those plans, because a lot of them actually really benefit you. Before we get started, if you find the information in this video helpful, I'd appreciate it if you gave it a thumbs up and subscribe, and leave a comment down below. And now we can talk about exactly what makes Massachusetts so different. When we first talk about Medicare supplement plans, a lot of times what you see is this big chart, and it's a chart of a lot of different plans based on letters of the alphabet, and in most states, we pick a plan amongst these. But in Massachusetts, these are not our plans. We don't look at this chart with all these letters. These don't even qualify for us. It's actually much, much smaller. So when we look at Massachusetts, we've got about 3 choices, and for most people now, it's really actually only 2 choices. So rather than a Plan F, a Plan G, a Plan N, if you've heard of those, that all goes out the window, and we're here with our Core Plan, Supplement 1 Plan, and Supplement 1A. So let's talk about the basics first. That's going to be the Core Plan. So if you have done any research into other Medicare supplement plans, a Plan A is very similar to a Core Plan. But if you don't know what that is, essentially the Core Plan is the very basics. So every state is required to offer a Medicare Supplement Plan A. It's just termed as a Core Plan in Massachusetts. So these are the very basic benefits, like your Part A co-pays, your Part B co-insurance, and first few pints of blood. But you'll see the things that are not covered are things like your Part A deductible, your Part B deductible, foreign travel emergencies, skilled nursing care, things like that. So this plan really takes kind of the core benefits that they have to offer from Medicare and on the state level. So it's very low coverage plan. Now, the next plan that comes into effect is Supplement 1A. So again, if you've looked at other supplement plans, this is very similar to a Plan G. So what that really means is on this plan, you have your out-of-pocket is your Part B deductible, which anyone turning 65 in 2020 or later, your supplement plan can no longer cover your Part B deductible. So this Supplement 1A, you pay an annual deductible of $198 in 2020, and then you've got pretty full coverage from there. Your Part A hospital deductible is covered. Part B co-insurance is covered. There are no excess charges in Massachusetts. This covers your skilled nursing, 80% foreign travel. It's a very full coverage plan. Third plan I'm not going to talk too much about is a Supplement 1 plan. And that's because this plan is no longer offered for new enrollees into Medicare starting in 2020. So if you, again, know those other plans, this is very similar to an F plan because the only difference between a Supplement 1 and a Supplement 1A is that Part B deductible. Your Supplement 1 covers the Part B deductible, Supplement 1A does not. So Supplement 1A is kind of the fullest coverage plan. And really the difference in premium between the two is almost always more than the Part B deductible. So going with a Supplement 1 plan is usually not the most cost-efficient decision to make. So we know our choices, we pretty much break it down between the two, and it's kind of choosing what's going to make the most sense for us and who's going to make the most sense for us as an insurance carrier. And that's what I do. I assist people in finding the very best Medicare supplement plans. I am licensed in Massachusetts. You can always give me a call. My number is 833-65-JAMIE, or you can visit my website, MedicareByJamie.com, and I'll walk you through the benefits of either of these plans, as well as what insurance carrier I would work with to set you up with this plan. Because everything's a little different in Massachusetts, and the next thing I'm going to talk about is why we would weigh between the two, because you might be thinking, the core is not a lot of coverage, why would I ever go with this plan? And that's because in Massachusetts, it's year-long open enrollment. So what that means is you are guaranteed to issue these plans all year long. So in a lot of other states, if you want to change from one Medicare Supplement Plan to another Medicare Supplement Plan, you have to pass medical underwriting. So you have to be pretty generally healthy to go through, and these plans have the option of denying you or also putting in a pre-existing conditions factor. In Massachusetts, that is not the case. There's no underwriting, there's no pre-existing conditions factor. You can go from one plan to another without having to pass your health history. So it's a great option in Massachusetts, which is why some people do opt for things like the core plan when they are 65 and don't need that full coverage, and then switch into a fuller coverage plan later. Again, I would be more than happy to go through all of that with you on a one-on-one basis. The other good thing to know about Medicare Supplement Plans in Massachusetts is these plans are community rated. So Medicare Supplement Plans premiums, there's 3 ways they can be rated. It's attained age, issue age, and community rated. And what community rated means is that the premium is the same whether you enroll in the plan at 65 or 95. So the premium upon initial enrollment is the same no matter what age you are when you come in, which is great for a 95-year-old, but not so great for a 65-year-old. If you're coming in at 95, you're paying like you're 65. If you're coming in at 65, it's basically like you're paying at 95. So it's not the greatest, most beneficial thing, but you know that if you hold off your retirement for a few years and don't enroll in Medicare immediately, your premium's not going to go up every year upon your initial enrollment, which is really great. The initial enrollment premium always stays the same because it's community rated. So that's another great thing about, again, if you hold off for a little bit, but not so great if you come in at 65. When it comes down to these plans, like I said, it's a little less scary because you've really got 2 options. What I would do is probably start with a core plan if I'm really healthy at 65 and possibly switch to a 1A plan if I need it in the future, utilizing that year-long open enrollment. But then it also comes down to what insurance carrier do I pick? And again, that's where I come in and I will assist you in finding the best rate for you because as we know, these plans are standardized and regulated. So it's really about what's going to be the best deal for us. So any questions, you can always give me a call. My number is 833-65-JAMIE. So visit my website, MedicareByJamie.com, where you can request a free Medicare Supplement Plan quote, or you can even email me, jamie@MedicareByJamie.com. If you like this video, please give it a thumbs up and subscribe. Comment down below. Again, thanks for watching and go Red Sox. Hi, I'm Jamie Banner, the founder of Medicare by Jamie. I'm going to give you a quick run through of my website so you can easily navigate and find all the important links and information I provided for you. So when we get started, we're going to be right on the homepage, and the first thing you can see is you can request a Medicare Supplement Plan quote. And that's what I do. I assist people in finding the best Medicare Supplement Plan options for them. So if you go ahead and put your zip code in there and a couple other basic pieces of information, I can get you the best supplement plan quote in your area. Once we get away from there and we go up to the top, we can see the Resource Center. So if we click on the Resource Center, we've got a couple options under there. The first one's going to be Video Library. So when we click there, it's going to take you to a page that shows you all of my YouTube videos. So all my videos will be on there along with their titles, so you can easily kind of search through them and see what video you're looking for based on your current needs. There's also a button up there that says subscribe to YouTube. So that will take you straight to my YouTube channel where you can subscribe, comment, do whatever you need, and find all the videos you need. When we go back to the Resource Center, the next link is going to say important links. And that's going to be a ton of different hyperlinks that give a lot of information like finding doctors that take Medicare, maybe filing a claim if you had something, lots of different things that can take you out to show you things you can do for Medicare. And the last section is going to be guides and forms. Now, this one is really important. I've listed a ton of forms that are going to be very important for Medicare. Stuff like employer coverage forms if you're still working past 65, IRMA appeal forms, maybe if you need to check your Part B premium based on your income. I have all of that here, plus a lot of different informative PDFs that's going to give you as much information as you need in Medicare, because that's what we want. We want you to be completely educated on everything Medicare related so you can make the best and most informed decision. I've also got it up here where everything is divided into categories. So if you need to find something a little bit faster, just click one of these categories and it's going to narrow it down to things involved in that section. Again, if you have any questions, you can always call me. My number is 833-65-JAMIE. You can also email me at jamie@medicarebyjamie.com, or you can go to the website and hit the Contact Us button and you can send me a little information. I hope you found this video helpful and thank you for watching.